Hi, everybody, and welcome to the Rebound Idaho. I'm Michelle Edmonds with Idaho News 6. We are so glad you can be joining us live on Facebook today. We have a really special rebound for you. And the reason we do these is to make sure that we are all in this pandemic together, that we are trying to make sure we can do our very best here at Idaho News 6 to bring you expert opinions about what needs to happen to make sure we can get through not only the COVID-19 pandemic, but help Idaho rebound with its economy. And today, in perfect timing, as we've seen a spike in the COVID-19 numbers here in Idaho, I want to bring in today's expert to the rebound, and this is Dr. Amy Kahn. She is the Executive Medical Director for Regence Blueshield. Dr. Kahn, thank you so much. We're so glad to have you today.
Hi, Michelle. Thank you so much for having me. I appreciate it.
Well, let's first take me back in the medical community world. Take me back to March or even beforehand when COVID-19 came into kind of the existence of the world. And I'm talking about our own little worlds here in Idaho. When were you first hearing about this virus? When did it really catch your attention?
Well, of course, I think I was very much aware when the World Health Organization, from their office in Wuhan, China, made the announcement that there had been a atypical pneumonia, a viral pneumonia, among their residents. And then, of course, shortly thereafter, the determination that this was a novel coronavirus, meaning that none of us had ever seen it before. So the entire population was not familiar or immune to this virus. And then very quickly, once we had our first cases in the US and we started seeing increasing numbers, of course, to our neighboring friends in Washington State, in particular in the Seattle area. And then when the World Health Organization, of course, announced this as a pandemic, it didn't take long for this to get on everyone's radar. And in certain communities, of course, we were starting to see cases uptick, particularly in the Boise area, of people who came in with signs and symptoms suggestive of this novel coronavirus that we call SARS-CoV. That's the virus, but because it was identified in 2019, we call the disease COVID-19. It was quite a alarming and really unprecedented in our lifetimes, at least, experience to realize that this was spreading through our community and that we were still learning a lot about it because we weren't exactly sure how this virus would behave and how we were going to treat it or prevent it.
We are live with the Rebound Idaho, Dr. Amy Kahn. If you're just joining us, we want to take your questions and comments as we continue our discussion. And we're going to get into testing and tracing and stopping the spread, all of those things. But I was just reading, Dr. Kahn, that Johns Hopkins University, now saying we have 9.2 million cases worldwide. And of course, you have spent time at the Centers for Disease Control. When you first saw this coming on and were seeing things like never happened before, in your own personal world, in the medical world, how did that affect you?
Wow. Well, I think it was very humbling, to be absolutely honest. Of course, I had been very familiar with the prior SARS outbreak, the Mediterranean respiratory virus outbreak. These were also coronaviruses. But to be able to start tracking in real time the incredible increase in the number of cases globally and within the United States was alarming, to say the least. And of course, we very quickly were putting in place mitigation measures, advising the population about precautions, making sure that people understood about hand washing, making sure not to touch your face, your nose, your eyes, really getting the message out quickly to understand how this respiratory virus was spread with an emphasis on droplet spread. And that was something that we really know, at least initially, was the key piece. We wanted to make sure that people were not exposed to droplets. And I think at first we really thought about the large droplets, and now we really understand that even those very tiny aerosolized droplets that might be generated through loud speech or singing or yelling and of course sneezing and coughing, how important it is to really have people protecting themselves with masks to avoid getting exposed or exposing someone else.
Ada County, as people we've been reporting here at Idaho News 6, has just today, as of today, moved back a phase. Idaho, of course, had these 4 phases of opening back up after the complete shutdown. Ada County itself having a spike in coronavirus cases, and Central District Health moving us back to phase 3. Is that an appropriate response, in your opinion? And what can people expect when it comes to openings and closings?
Because that's a great question, Michelle. And I think we need to embrace the fact that we are all living through history, right? I think the governor's approach to a phased opening was always meant to be a dynamic approach in which we continued the public health surveillance, tracking the number of cases, and being very nimble in either opening up or scaling back, depending on the burden of cases, recognizing that, as we've seen in Ada County, that as we've opened things up, there have been more people mingling, more opportunity for the virus to be transmitted between people, resulting in more cases, more hospitalizations, and deaths. So this idea of moving back really is a measured approach to protect the public, each other, our families, our community, our elderly persons, those who have other co-occurring conditions, and most importantly, to allow Idaho to be successful in reopening. We need to be laser focused on each doing our part to keep the number of cases down. We certainly understand there are risks to overwhelming any number of our communities, particularly the hospitals, should we have a big spike in cases in community, and recognizing that there are steps each of us should be taking to be able to decrease the likelihood of transmission. Really important piece, and our responsibility to reopen in a healthy way, in a way that's sustainable.
Is it a whole new world we're living in? Do we need to view how we approach life as this is where we are, perhaps until there's a vaccine?
Yeah, I think that's a way to look at it. A lot of times people will tell me, well, Dr. Kahn, when are we going to get back to normal? And I really pause and say, this is a new normal. And we're getting to define the story. I would bring us back to the days where we didn't wear seatbelts, right? Now, today we wouldn't think twice about, well, not wearing a seatbelt. But there was a point in time where we just didn't wear seatbelts. And of course, that was linked to a number of motor vehicle casualties or fatalities. And we know now that it protects us as the driver or passenger, and it protects the other person in the other vehicle should they be involved in a motor vehicle crash. Another example would be smoking in restaurants. Of course, now we know, we don't smoke in restaurants. We want to protect our health as patrons, but also our food servers. And so those were changes that happened over time and weren't initially embraced. What I would say to folks today is, what do I need to do to assure that Idaho can thrive, that as individuals we can stay healthy, and that our businesses, our schools, the things that we enjoy are meaningful in our life can continue to occur in an ongoing basis. So wearing a face mask or staying physically distant, staying home if sick, washing our hands, and of course getting tested if you do have signs and symptoms suggestive of COVID, so that you can isolate if infected and make sure we're following up on people who might have been exposed to us. Those are steps we can each take to, again, keep our economy strong and keep Idahoans healthy.
Let's talk a little bit about who should get tested and when they should get tested, because we hear about testing and we've heard about it since the media really brought this to the forefront as the pandemic hit in March for us. But I think there's been a lot of question about if there are enough tests, and then when do you decide who gets tested? Is that an individual decision? Do you contact your medical professional? Can you address that a little bit?
Sure, absolutely, Michelle. And probably makes sense to just talk a little bit about testing. We hear COVID testing all the time, but I want to make sure that our listeners are aware that there really are two kinds of tests for COVID. The one that's most important is the viral test, and this is either an antigen test or you might hear PCR or a molecular test. Basically, these are tests that indicate whether or not you are infected with SARS-CoV, the virus that causes COVID-19, or maybe recently infected with the virus. The other test that we've been hearing about is the antibody test. And an antibody test is really a protein in the bloodstream, a type of protein produced by certain white blood cells that really are in response to have been infected or exposed to the virus. This latter test, the antibody test, is not used to determine if you're infected and may indicate, if it's an accurate test, and there's some challenges with that test, that you might have been exposed in the past. Unfortunately, we don't know enough about the novel virus today to say if you truly do have antibodies, are you immune from the virus, immune from getting the infection? So it's the viral test that's the most important, and it's one that we really recommend in particular for, of course, anyone who has symptoms suggestive of COVID, which of course would be cough, high fever, malaise. Many times people have a loss of smell. They can no longer taste and would be going to their doctor, or potentially if they've been admitted to the hospital, would be ordered through the hospital to determine infection. There are a couple other groups of people that also really need to be tested and early on, and that would be people in a high risk category. Elderly persons, persons over 60, 65 years old are at higher risk for more serious infection. We also know that persons who have other conditions like diabetes, heart disease, people who might be obese, persons who have a history of lung disease, obstructive sleep apnea, those who maybe have a cancer diagnosis and have had chemotherapy, these would be folks that we want to prioritize for testing. And of course, our healthcare professionals, as well as essential workers, right? We really understand that these are individuals who are exposed more potentially to sick patients or to other persons in the community. In the case of the essential workers, these are folks we want to prioritize for testing should they have symptoms. And then if you are infected, so important individuals isolate. And I think this is the tricky part. 80% of people who get infected are not going to have serious illness. Maybe they're asymptomatic. Some are what we call pre-symptomatic, which means that before they develop symptoms, they're infectious. And it's one of the reasons why we have to take precautions. And of course, if you personally have been in close contact with an infected person, it would be important to quarantine and monitor symptoms. And if you become symptomatic, get tested with that viral test.
Such great information. Again, if you're just joining us live on Facebook, I am here with Dr. Amy Kahn. She is the Executive Medical Director for Regence Blueshield and a wealth of knowledge when it comes to COVID-19. We've been talking about getting tested. I had a viewer comment here, Dr. Kahn, that I'd like to bring in. This is Vivian, and she's saying, is it true blood types play a role in getting the virus?
Well, that's a great question, Vivian. There have been a couple published reports now looking at large data sets and linking persons' level of severity of infection with their blood type. And there does appear to be a somewhat protective effect for persons who have blood type O. O type blood, they're known as the universal donors, and there may be some protective aspect of persons with that blood type. It's certainly an area of continued research to determine that, but for those who are fortunate enough to have that blood type, it's certainly not the majority of the population, but those who do may have a little bit more going in their favor, whereas persons with blood type A may be at slightly greater risk to have more severe infection. But it is an important piece to recognize is that we all are different, right? We're unique and we have a unique genetic imprint, if you will, and we have our own immune systems that we all have slightly different risks when it comes to developing more severe infection, keeping in mind that 1 out of 5 of us will get severe symptoms, likely to be admitted or at least seen through the emergency department, need to be monitored closely because a portion of those individuals, about 5% of people who get infected, are going to require hospitalization, potentially intensive care, as well as possibly ventilation on a ventilator.
When we talk about antibody testing, there are questions about whether or not, as you said, how much we really know and what we don't know. Is it important for people to go out and get an antibody test if they want to just know for their own personal information? Or perhaps I think as we start to try and reopen schools in the fall, is that a course of action that should happen?
That's a great question. And I would advise everyone that's listening to be very cautious about running out and getting an antibody test for 3 principal reasons. Number one, even if the test is accurate, and there's some challenges with the test, we do not know what it means to have a positive antibody response. Does that mean you're immune? If you are immune, for how long? Or is the antibody that's produced sufficient to neutralize, if you will, this virus, should you become exposed or infected? And I think we need to recognize that the coronaviruses are in a family of viruses. A few of them cause the common cold. About 25% of common colds are caused by different strains of coronavirus. And we know that you might be temporarily immune if you got infected, but next year you might get the same virus again. So there are some cautions about how do you interpret having a positive antibody test if it's an accurate one. The other issue is that there can be cross reactivity among the coronavirus families. So you might have had the common cold and would have an antibody to that coronavirus, and there may be something in your immune response that then shows up and gives you a positive COVID antibody. That would be a cross reactive result, which doesn't mean you're immune from this novel virus. And then the third area of caution is really about the testing characteristics itself. Lab tests aren't perfect, and there's always an important thing to consider that you might have a false result. So you could have a false positive result, meaning that you think you might have the antibody, but you're not really don't really have it, and it potentially could reinforce or somehow falsely reassure you that you might be protected. So we do not recommend that employers use the antibody test to decide whether or not somebody can come back to work or needs to take precautions or not. Everyone must take precautions. And the role for the antibody test is really best used in large population studies where we might want to look at groups of populations or certain communities to find out how far the virus might have spread to determine a level of population immunity, but again, not for the individual level. And there's been some recent guidelines that have come out, one in particular from the EEOC, the Equal Employment Opportunity EEOC, excuse me, Opportunity Commission. And that was to say that they do not advise, and in fact, they discourage the use of antibody tests to determine an employee's eligibility for work. You can, as an employer, get a viral test, which again, I said earlier, a viral test will determine, are you infected? I hope that helps, Michelle.
It really does. It makes a lot of sense. And I hadn't heard about the EEOC, so I appreciate you bringing bringing that up. Again, we're here with Dr. Amy Kahn, Executive Medical Director for Regence Blueshield. We're taking your questions and comments if you'd like to have any. She is a wealth of knowledge. So if you've heard things or you want to have some myths debunked or possibly see what possibly are your issues within inside your own family, we'd love to hear from you live right here on Facebook. Tell me a little bit, Dr. Kahn, about what you're hearing on the vaccine front, because as a mother right now, I am most concerned about, as many parents are, getting their kids back in school, making sure they're safe. But as you start to talk about how this virus can change and how different people react differently to it, how likely are we to have a vaccine that will work?
Well, what's exciting about what's happening in the area of vaccine development is that we have seen an unprecedented level of collaboration between public and private entities through the National Institutes of Health, with our vaccine manufacturers and developers who are in the private sector across this country, and are very quickly working internationally with other vaccine developers to identify a handful, I think there's at least 6 or 8 very strong vaccine candidates right now undergoing research in various clinical trials to determine which among them are likely to be the most effective in conferring immunity against COVID-19 for the population. And the important thing about vaccine development is that there are a number of different ways in which, or platforms in which vaccines are developed, different ways in which we attack a virus or a pathogen. And we're looking at several different platforms so that we are likely to see by the end of the summer, by the early fall, we're likely to see which of these candidate vaccines are going to be the most promising. Keeping in mind that the last phase of clinical trials is not only to determine how effective the vaccine would be in protecting individuals against getting infected, but it's also a phase that determines safety for the population. What we don't want to do is approve or develop a vaccine that maybe prevents the virus, but could cause other problems that we weren't anticipating. And so that's a very important phase of the trial. Assuming that we have a green light out of that phased approach of clinical trials and we have good vaccine efficacy as well as safety, what we are doing today, given we've got over 330 million people in the US and billions worldwide, knowing that we all need to be immunized. This is a global pandemic. There are no borders here. Our vaccine manufacturers have embarked in what we'd call at-risk manufacturing through a program called Operation Warp Speed to start developing some of the substrates, some of the vaccine ingredients, so that when we determine go live, yes, we've got the right vaccine, that we can very quickly produce that vaccine for distribution. And I would imagine as this vaccine gets approved and distributed, we would be prioritizing those most at risk and then working through the entire population with the hope that the majority of Americans would get the immunization to protect the entire population.
We are getting some interesting questions in that I'd like to bring in. This is Kathy, and this kind of goes to what our new world looks like right now. She is asking if family members took a trip to the Oregon coast, should they have quarantined for 10 days on their return? And I would broaden this question out to you, Dr. Kahn, and say, right now we have learned that numerous states have put in place quarantines of actually 14 days. Talk a little bit about travel, because right now families are desperate to take their summer vacations. And here in Idaho, going to the Oregon coast seems like such a safe thing to do. Is it safe?
That's a great question. Thank you, Kathy. Well, what I'd like to offer is this. This is, again, it's a disease that has no borders right now. The virus has no borders. And so whether you're traveling to Oregon or you're coming down to Salt Lake or you're heading over, into the mountains, I think what's most important is to understand is that this virus is spreading through our communities, and in some communities more than others. If you took a trip to the coast with your family, what's important is who were you exposed to? Did you go to large gatherings? Were you practicing those appropriate precautions like social distancing, at least 6 feet apart, using your mask, good hand washing? If a family member was sick, did they isolate? Again, isolating from each other in that case, so they didn't infect the family. I think it doesn't really matter at this point where you go. I mean, I'm talking about domestically. But when you come home, if you were exposed to people who were infected, there's a likelihood that you could be incubating. I want to talk a little bit about what we know about the virus. It has an average incubation period of about 5 days, but the range of incubation is 2 to 14 days. So someone who has been exposed to this infection, the quarantine days is about 2 weeks, is 14 days. We want to be cautious on that outside number because you could be one of those folks that is still incubating, and we want to keep everybody safe. If you are infected, meaning you have the disease, you want to isolate for at least 10 days since the start of the symptoms. Because remember, you were incubating before you had symptoms. Usually 2 days before is when you can still be infectious, spreading the virus. So that's where that 10 days comes into place. But if you're getting tested, you'd want to have at least 2 negative viral tests within 24 hours apart if you were going by testing before that infected person would want to get out and about. So hopefully that helps.
Most definitely. Holly is asking you, what is the likelihood of schools opening in the fall?
Oh, right, Holly. I think all of us, parents, families, kids, educators, are eager to know how are we going to successfully continue to educate our children? How are we going to open our schools? What's it going to look like? And a lot of this goes back to my earlier comments where we need to understand how important it is to be flexible and dynamic. In Idaho, if we quickly adapt to wearing face masks, staying physically distant, staying home if you're sick, and we start seeing those numbers continuing to go down, we will continue to thrive and we will be able to keep Idaho open. I suspect that our schools are absolutely planning to open at this time, but if there's a outbreak in their community, at the time that school's about to open, there may be a need to postpone that opening. So if we think that we are going to take the steps to rein in the virus, we are making plans to open and considering all the options. What's the capacity to do distance learning? What's the capacity to sort of put the kids in groups so they're not intermingling. So if there was an infection in one classroom, it wouldn't be spread throughout the school. What's the opportunity to stagger the school hours or have some kids going on Monday, Wednesday, and others going Tuesday, Thursday to minimize the density of student exchange? I think all of these are considerations that are going to allow us to be successful come the fall. However, I do want to say, I think it was Boise State this past week had to rein in a little bit some of their summer school classes because of the additional outbreak of cases that we've seen in the community.
That's right. They had a tie of 8 cases to the campus, and they closed campus all this week to do heavy disinfectant. If you're just joining us, Dr. Amy Kahn, the Executive Medical Director for Regence Blueshield, is joining me here on the Rebound Idaho. So appreciate the time she's giving to all of us. And we've got a few more questions coming in. If you don't mind, Dr. Kahn, staying on and answering a few more, is that okay?
Of course, yeah, happy to do so.
So we're going back now to talk a little bit about when we were talking about the vaccine before. Vicki has this question, and I've heard this from many people. So don't viruses mutate somewhat from year to year? So she's talking about the flu shot based on last year's flu is only somewhat effective for the following year. Would this be the same for COVID is what she's asking. So viruses and their mutations, and what about a vaccine? Would it be enough to keep up to speed?
That's a great question, Vicki, and thank you for asking it. We do often think about influenza, and we know that now we recommend a quadrivalent vaccine, which is representative of the four most likely strains of virus that are going to be circulating in the northern hemisphere. The vaccine manufacturers will determine that usually in almost the year prior for the following year, depending on the prevalent strains both in the north and the southern hemispheres. And that's because influenza viruses do have the capability to shift and drift in terms of their genetic makeup, so that we have to get immunized every year to have the right antibody response to be able to fight those infections. With coronavirus, and in particular for this novel coronavirus, SARS-CoV-2, we are still learning about it. There are several areas of the virus that appear to be conserved, which are consistent. And yes, there may be some mutation in the virus, but the targets for the vaccine would be for the most stable part of the virus, such that we would not likely see the need to have a new virus or vaccine manufactured every year to be able to tackle this novel COVID coronavirus. So it's a great question. We're still learning about how quickly this vaccine might change, but the prevailing thought in the vaccine community today is that we would be able to develop a stable vaccine that could be used year over year and not have the requirement like we do for influenza vaccine on an annual basis.
I want to bring in Cindy here. She kind of hits on a point where this virus has been difficult on so many of us, but she's asking, and I'm not sure, Dr. Hahn, you can answer this directly, but are there recommended reasonable accommodations per American with Disabilities Association for accessing community services? And the wider question here, of course, being that there are vulnerable populations and there are populations that need extra protection and help already. And this virus has done a number on those communities.
There's such an important piece for us all to embrace is that we're not all at the same risk. And for persons who have conditions that put them at increased risk of more severe infection or increased risk for death, extra precautions and accommodations do need to take place. In workplaces, if a person has severe lung disease or cancer or is elderly, it's important that there are options explored for that individual to potentially work from home or modify their work activities or perhaps flex their schedule so they're not coming to work when there's a high density of people there, making sure that there's all those other environmental protections put in place, the physical distancing, the plexiglass shields, the protective equipment, the hand sanitation stations, the frequent cleanings, all of those need to be taken into consideration. But I would submit that persons at higher risk are those in which we want to proactively take steps to keep those individuals protected from infection. We're still learning again about how we are going to treat this infection. We've got some newer agents and agents that we've used for other conditions that we are exploring their role for treating people who have more severe illness, but it is certainly something we know if we can prevent it, we think that is the most important priority at this time.
Let's talk about stopping the spread. And specifically, let's get down to the hard measures because we've all known since we were little kids that hand washing is important. We all have bought detergents and products that can help us keep our homes clean during flu season. We get those things. But as Americans, wearing a face mask in particular seems to have the highest rebuttal from people. And perhaps the other one, social distancing, words that didn't even come into our language before the coronavirus. Can you specifically address how important it is to wear a mask and social distance?
I sure can. Yeah. And I think it's important. We are a culture that's very effusive. We like to handshake. We like to hug. We don't wear masks. It's really a very different kind of culture we live in. But what I think we are living through is a absolute change in how we appreciate each other and how we greet each other and how we support each other. So in the case of physical distancing, there have been a number of studies now that consistently demonstrate that the farther apart you are much less likely to transmit this infection. To put it down into numbers, if you are more than a meter apart, which is about 3 1/3 foot or just a little more than a yardstick apart, your odds of transmitting infection, COVID-19 disease, go down 80% if you are more than a meter apart. If you're 6 feet apart, they're virtually not going to be transmitted. So important to recognize that's such an important piece. So standing apart, maybe a simple nod or a bow, right? A facial greeting, that where you can, air hugs as we call it, right? You kind of gesture is important. In terms of the masks, I want to share with you there are a number of studies now that have very consistently demonstrated that the odds of transmitting infection if a person wears a cloth mask covering is reduced by 85%, which means that if I'm wearing the mask, am less likely to transmit infection to you. Conversely, if you wear a mask, you're going to be less likely to transmit infection to me. If we both wear a mask, that's the safest situation that we can be in. I think it's important to recognize that there are different kinds of masks, and in the healthcare setting, people who are in close living settings like a skilled nursing facility, a group home, incarcerated persons, masks are really important. Healthcare in particular may need surgical masks or what we call N95 masks because they'll be working with infected COVID patients.
If you could put, and I know I might be putting you in a hard spot as a doctor, and I realize that, and you can tell me to go fly a kite. I completely understand that. But if there's one recommendation you could give to people, would it be masks or social distancing or hand washing? Like, is there one that is the most important that if you don't do that, we're never going to get through this thing? Because it just seems in sometimes like it's so much on us, Dr. Kahn, all of a sudden.
Yeah, that's a great question. And I think what I would like to just first reference is that we live in a climate where during certain times of the year you put on heavy coats, you put on a scarf, you put on mittens, you put on your boots, right? It always takes a few minutes longer to do that, but we do that because it's cold outside, right? Snow is blowing. um, this is something I would just say is that masks need to be just part of our articles. Don't leave home without it. Think of it as just that other thing tuck in to you have in your car, or you have in your closet, you have on your table on the way out the door, that you bring with you and you put on when you're going out to be, especially indoors, especially when you can't be 6 feet or more apart, especially when you're going to be with a group of people, right? To protect and keep yourself healthy and protect that other person. And I would say for you as a employee, if you've got a job, you've got a business, you're a teacher, you're going to school. This is to allow us to really start thriving again in our lives and think of this as our investment with each other to be successful. So I hope that's a helpful way to frame it. I think it's a way of new muscle memory for many to develop this practice so that it's not a second thought. It's just part of what we do every day. It's brushing your teeth, right, on a regular basis.
So we always like to end our Rebound Idaho segments with what I like to call the silver lining, because so much of this has been so difficult for so many. And I'm not talking about death rates in particular, although that is terrifying to most people, but just the idea of the new normal that we are now living in. Can you, Dr. Kahn, give me a silver lining that you have seen from your expert perspective in the medical community about when we get through this, whether it be the vaccine or what it might be, and when that's going to be? What's your silver lining?
Boy, there have been a few. Thank you, Michelle. I think the biggest is that not only do we all need each other, we are more connected now than we've ever been, and that we are going to not only survive, but we are going to successfully get through this together because we're supporting each of us, no matter where we are, to get through this. And I think that's the most important kind of silver lining is that we are going to get through this and we're going to thrive. It's going to take a little while and there's going to be some bumps along the way, but we are connected more than ever. And I feel like that level of understanding that when we see each other, greet each other, work with each other is going to allow us to be most successful.
I love hearing that coming from you. Dr. Amy Kahn, the Executive Medical Director for Regence Blueshield, we so appreciate you joining us on the Rebound Idaho today. Thank you for your expertise. Thank you for the hard work you're doing in our community to keep us safe and healthy. And thank you for answering questions.
Thank you so much. Have a great day. Appreciate being here.
Thanks for being here for the Rebound Idaho, everybody. We'll see you back here tonight at 5 o'clock.